Hi, everybody. I'm Dr. Anna Saylor with Every Chiropractic Center, and here we are with Aaron. So why don't you introduce yourself?
Hi, my name's Aaron Wallace. I'm the owner of Balance Your Fitness, and what I am is what's called a CHEK Practitioner. And so if you guys have ever heard of a CHEK Practitioner before, it stands for Corrective Holistic Exercise Kinesiology. And what exactly is that we do is my 10-second elevator pitch is to be able to go and help understand the CHEK Practitioner. What we do is we combine the techniques of massage therapy, physical therapy, exercise, nutrition and lifestyle coaching, and other different stress management techniques all in one place. Each person is their own set of physical, chemical, mental, emotional, and spiritual stressors. So no matter whether you're suffering from things of chronic pain, chronic disease, gut health issues, hormonal issues, or perhaps struggling with weight loss or not getting the most from exercise, that each person is their own set of stressors. And there isn't really a cookie cutter style approach that works for everyone. So we have to be able to go and design a program that's individually customized, just like every adjustment here is individually customized to each person for their own individual needs.
Okay, so share with everybody, okay, where are you located first?
So we're located at the northwest corner of Square Lake in Livernois, in Troy. So about 5-6 miles or so from your office. Okay. So not too far. So right in the area, and we've been there since beginning of 2013, January 2013.
And it's called Balance Your Fitness.
Balance Your Fitness is the name of my company, and so it's been there since January 2013, and we specialize in working with a lot of people with chronic pain. That's a lot of times what I end up working with quite a bit. And so I know a lot of people who are struggling with chronic pain that come to your office and come to a lot of chiropractors' offices. And so the biggest struggle a lot of times that I hear from both the professionals that I get referrals from and also those who have been through the traditional medical system is that, and this is no fault of the people that are in that system necessarily, it's a lot of times when your discharge after an injury from physical therapy or a particular other different modality is that there's not a lot of places where you can go that will work with people that have a lot of chronic pain and injuries when it comes to exercise specifically. And that going into and looking for someone who has the type of skills to work with people who have been in chronic back pain, it's hard to find that you're just traditional fitness facilities that most people frequent, whether that's the local ones down the block or the big block chains. They end up going and working with people who don't have a lot of those types of issues, which is fine. But we got to be able to have something for people who need a little bit more TLC.
Okay, so just kind of walking our patients through, like what would be like a first visit to you? Like, what do you look at? What do you assess?
So when we go through our first physical assessment, so I'll go through the physical and also some of the other different chemical and mental emotional stress questionnaires. But first, the physical assessment. How we go and assess is understanding some more of the root causes of pain and dysfunction. So there's a good way to, it's a good picture of this is imagine a totem pole. And this is actually a physical picture of this. It's called the CHEK Survival Totem Pole. Okay. And at the bottom of the totem pole is a picture of a little slave working in a field and the picture of the cervical spine, the thoracic spine, the pelvis, the lumbar spine. And that's meant to symbolize that where you're having the pain, whether that's in your knees or your hips or your ankles or your lower back or upper back, is that there are issues going on that are more important to basic survival that dictate positions of your spine and the rest of the joints of your body, where a lot of times you experience that chronic pain. So the top portion of that would be things like how well we can breathe. So if we can't breathe very well out of our nose, our head automatically moves forward and tilts up to be able to open up the nasal airway so that way we can be able to breathe better. However, when our head moves forward, we put a lot of stress on all sorts of different joints. It could be the shoulders, it could be the knees, it could be the back. So we can get pain in all sorts of places. where a lot of times when you go to your normal physical therapy office is that, again, when you get a script for therapy and they tell you we're going to work on the shoulder for shoulder pain, they're going to go and work on the shoulder.
Just
right?
the shoulder.
Because in the end, that's what insurance is going to pay them for. If a physical therapist were to go out and just say, hey, I'm going to go and work on your breathing after you've got the script for shoulder pain, the insurance company is going to not get a stroke on the check. They're going to go and deny the care. So, but the idea is to be able to go and understand that there are some of these more important root cause issues, and that goes for breathing, for vision and hearing. If you can't see very well on one eye or hear very well on one ear, you can always, that posture gets distorted that way. So imagine like I'm constantly going and having a conversation, I'm always turning my head to be able to get my good ear towards conversation or my good eye towards vision. So being able to determine where some of those root cause issues are and be able to help alleviate those first, along with going and helping to strengthen the body and relieve issues with posture and flexibility.
Nice. Okay.
And so as well is that one of the things that may be a little bit different than what you've experienced in other different forms of fitness or wellness facilities is that everything that we go and design is all on video that you can access 24 hours a day, 7 days a week. And since we're on Facebook Live, we're utilizing all this cool technology, right? And eventually this will be uploaded to YouTube. I have a whole library of videos on YouTube that when someone comes in for a visit and we're working on teaching some various different stretching or self-manual therapy or utilizing a foam roller or corrective exercise, everything that we design is going to be accessible 24 hours a day, 7 days a week, right from your smartphone.
Which is actually brilliant.
Yeah.
Because I cannot tell you how many patients have come in with a piece of paper or like sheets of paper and say, how do I do this? Like they show me once, I don't remember, and they're doing it wrong. And so that is awesome. Like, I'm so appreciative.
Well, you know, it was sort of born out of necessity for me because I don't know, but you get these stacks of paper, and sometimes, you know, when I used to use paper way back in the day, and you know, I get questions like, how do I do this? And I'd be getting calls on my phone from people, and it's good. I'd be happy to answer those questions because I want to make sure they're doing it right. But I'm thinking there's got to be a better way to do this. So everything that we design will be all accessible 24 hours a day, 7 days a week. So that way you don't have to guess. You can be just like, you know what, how do I do this one again? You can go right to the video, so that way you don't have to go and guess. Perfect. And so that's another, that leads to another big difference is that working with a CHEK practitioner, working with our office, you don't need to be seeing me 3 or 4 times in a week, even people who are struggling with chronic pain. The idea is to be able to teach you how to fish, so to speak. So that way you can be able to go and learn to do for yourself as much as possible. Because in the end, we all have places to be, places to do, places to go.
Things to do.
How many times am I going to screw that up? You know, places to go, things to do. We all have kids to take care of. We don't have the time to be bouncing around 3 or 4 different appointments a week. I mean, we all have jobs. We all have families. We all have things we need to be able to go and do. So how can we do this as efficiently as we can and as safely as we can? And that's the key.
Okay, so take us to the rest of the totem pole.
All right, so you have breathing, then you have the function of the temporomandibular joint. So if we have issues with the temporomandibular joint, so just going through a little bit of basics of TMJ, if we're not familiar, is that every time your mouth opens and closes, if there's some form of dysfunction, whether that's from sometimes people chew gum all on one side or tend to chew their food all on one side and have a little bit more developed cranial muscles that go control one side versus another. Sometimes as you open and close the jaw, one side will pull to the jaw will pull to one side slightly. And now it's not noticeable really until you actually go and learn how to assess these things. But if that happens, what happens is that the teeth don't fit in quite right. So there's an adaptation that happens over time that your head will turn slightly or tilt a little bit to make sure the teeth fit in. So that way the teeth don't grind out. As a basic survival mechanism, we don't want our teeth to grind out or else we wouldn't be able to chew our food and live. So that's really important. So our body then goes and distorts the spine and the rest of the joints to be able to make sure that the teeth fit in properly. The next is vision and hearing would be the next steps on the totem pole. So again, if we couldn't see very well out of one eye or hear very well out of one ear, we end up going and distorting posture as well. Then it goes to the positions of the upper cervical spine, since that's a lot of basic control center of the rest of the spine, where the cervical spine goes, the rest of the spine tends to follow.
Our patients are very familiar.
Exactly, yes. So very familiar with that. Then we're going and looking at issues of the digestive system. So for example, if you are consuming foods that you're not digesting well enough, so for, gluten and dairy products tend to be the biggest allergens, right? However, each person can have their own specific issues, and that's not specific. Not everybody has these issues. But if you're having trouble digesting your food, you've got inflammation in your gut. What happens is that the inflammatory response turns off some of the segmental spinal stabilizers, those smaller muscles that you don't necessarily feel, but you'll turn those off because those organs don't like the extra pressure that those muscles try to go and put on the abdominal cavity. So when those muscles turn off, you end up putting more pressure on the discs in your spine and the nerves, and you end up going and putting some more risk for injury when it comes to that. So a lot of times people get lower back or lumbar or lower thoracic pain or discomfort. A lot of times that can be an issue as well, from the gut issues as well. Then it goes down to mental emotional stress. So if we're dealing with a lot of mental emotional stress that we're not addressing, that can affect us physically. So each section of the totem pole then goes to the bottom, and that's where the bottom of that totem pole, the slave joints, as we put it, those take the beating for all the other more important survival functions. Because in the end, on a survival basis, right, if you flash back 10,000 years, once we reach the age of 40 and we've had kids and our kids are starting to have kids, as a survival mechanism, our joints aren't really necessarily meant to go and last beyond that unless we're in really good alignment and we're taking care of our body, because we didn't need to have them necessarily as a way for us to pass on our genes and evolve. But if we go and know some of these issues that we're having, we can be able to then go and allow for us to create better balance and better postural improvement without actually going and working on the specific area where you're hurting. A lot of times when people go out there and say like, oh, my knee's hurting, I have to work on the knee, and it's all inflamed, and you end up making it worse. So that's a big problem. So we have to be able to go and understand that where's the root cause of the pain, and it's not your knee. It's everywhere else but your knee a lot of times, and I'm sure that's probably a lesson that you've gone
for us, certain emotions live. Like today a patient came up, both her knees were really bothering her, and we talked about it, and for us it's stubbornness. When you're not letting go, and when think about a toddler that locks their knees in when they're stubborn and they're just they don't want to do something. And as soon as I said that, she was like, yeah, that's exactly what it is. So we look at the body too the same way. Like a lot of things that happen in the body are not causing, it's not the knee, it's the emotion behind the knee.
Absolutely. And so when you talk about mental emotional stress, one of the questionnaires that I would go and have a person fill out as a first visit is a questionnaire asking, one of the major questions is to ask name the 5 most stressful events in your life. Now, I understand when you're writing a first questionnaire, right, and you meet me for the first or second or third time, that this is a process, right? So hopefully we can be able to help understand that if you do have a lot of these sort of built up emotional traumas, that realize that they can affect us physically, and that there is a way to be able to help unwind them. It's not a magical swish and flick style fix, but the idea is to be able to, if we understand, we can be able to start to make and understand that there are specific changes we can make. Think about stress in any way is like a cup of water. If I were to go and pour too much water in the glass is going to overflow. Any form of stress in our body, whether that's physical, chemical, mental, emotional, or spiritual, all summates into the production of your stress hormones, cortisol and adrenaline. And so what happens is that if we go and we have water, a cup full of water, so to speak, and where, you know, every day is a struggle to make sure we don't overflow and blow up on somebody, right? Or our, you know, joints don't hurt us, or wherever our particular symptoms are coming from, is that we have to be able to go and say, what are some of the other ways we can lower the stress? Because if you're having a stressful job, no one's going to go and quit their job often just because it's stressful. Let's work on some of the other physical, chemical stressors that we may be dealing with, so that maybe the stress from your job isn't quite so bad, or the stress from other different traumas that we've been dealing with, and allows us to go and start to bring them to the forefront, and allow us to be able to go and help to deal with them in a little bit less stressful manner. Because again, we put these things to the side, right? These types of traumas, because they are so stressful, and are so, you know, traumatic. And there's so many of them that we could go and talk about, but we have to realize that if we go and start to dump out some of the other stressors, or some of the other water that we put into the cup, we can be able to start to rewind some of those traumas and do a little bit,
and things like,
start to heal a little bit more.
Like we talk about here too, things like meditation and yoga and exercise, how you incorporate that into your daily life to take the water out of your glass.
And that's where the trick is, right? Is say, what's right for me, right? Because again, not everybody should be doing yoga, right? Not everybody should be doing, you know, full strength training exercise. What is that balance for each person? And that's a specific question for each person. And so, you know, I make there's a particular jokes that sometimes I make, is that every person who is a yoga master should not be doing yoga and should be doing strength training. You know, the person who can go and twist themselves into a pretzel and then ends up with massive amounts of back pain. I'm sure you might have had a few clients like that.
1 or 2 or 20 or 50.
Exactly, right? And then you might have had a few person who is a little bit of a gym rat and has the look of it, and they can't even touch their toes. That's the person who might need to be doing more yoga, whereas, you know, a little less strength training. So it's about finding the right balance between what that person needs to do, and that's an individual question. And so there isn't a one-size-fits-all answer, and if there was, I'd certainly be happy to give it, but unfortunately that's not the way our bodies work. And we all have our own stressors and traumas, whether those be physical or mental, emotional, and we have to be able to go and come up with an individualized plan for each person.
Well, wonderful. So thank you so much for coming.
Well, thank you. And I wanted to first off thank everyone also listening today. And as I say in the description of the video today, there's going to be a free gift. So the free gift I'm going to give away is $250 worth of free services at Balance Your Fitness. So if you've never utilized this or heard of a CHEK Practitioner before, this is a way for you to be able to go and learn a little bit more, and to be able to have a risk-free experience to determine, is this something that's right for me? So that, and again, that's an individual question. That's why I want to be able to learn. So we'll be able to go and have some information in the description below. You can check out my website, balanceyourfitness.com. And all my information's on there as well. You can go and take and look us up.
Awesome. Right. Well, thank you.
Well, thank you very much.
Okay. Well, once again, I'm Dr. Anna Saylor with Every Family Chiropractic Center, and we look forward to talking to you soon. Bye, everybody.
Bye.